Hi, I'm Dr. Michael Ford. I'm an endodontist, and you may have seen a few of our amateurish attempts to explain a little bit about root canals. Today we're going to talk about infections. We're going to talk about how that the bone gets eaten away around the end of the root of your tooth from these infections, and what we can do to help with that. Some of these are very dramatic cases. We'll go through just one today, and not every case is like this. And not every case shows this phenomenal degree of success, but the options are there, and it can work for you too. Let's take a look at this. So we talked about how infections can get started. You can have these swellings in your face, swelling your eye closed, or swelling up under your chin. You can also have infections inside your mouth too. This type of infection is referred to as a sinus tract. Sometimes in lay terms referred to as a gum boil or a gum pimple. Something that's not natural, not supposed to be in your mouth. This one's fairly obvious. This one shouldn't be in your mouth. Now, this is a fairly serious infection around this tooth, and it's involving both of these teeth. This has been going on for a while for this individual, and it's been going on for such a long time that a lot of bone has been eaten away around the root of the tooth. We'll take a look at that too. First, though, let's just look at what we see when we look in. This is a big old bump right here. And push on that, well, you can watch Dr. Pimple Popper if you want. But let's take a look. When there's an infection like this, we try to determine exactly where the infection goes and how serious it is, how much gum support and gum connections have broken down, as well as bone connections. So we do what's called a tracing of this infection. We take one of the root canal filling materials, little sticks that show up on the x-ray. We put that in, and this is what it looks like. So that thing is about 28 millimeters long, about a little over an inch long. So you can see that this has gone up in here pretty far. So when we do that, then we also take an x-ray picture to see where this is going. Let's take a look at the x-rays here. So this is what this individual looked like to begin with. All this area up in here, this is bone loss that has occurred because of this infection. Now, there's been a root canal already done on this tooth, and this tooth in the back has not had a root canal. So you can see the root canal by the little white lines down inside. Remember I said the root filling material is what we use to trace. This is what it looks like when it's inside the tooth. When it's in the tracer, though, this is what it looks like. So this is that same little pink stick that you saw that's going up now, and you can see how far up into this tooth this is really going. Recall that we may have discussed about the three-dimensional x-rays or the CBCTs. We can see those also, and this is what a CBCT would look like. So this is the area. This is the actual area of the tooth right up in here where all this problem was occurring. So now this is a current one for this patient, but let's go back and look what the old CBCT would have looked like when we looked at the individual sizes or slices, as we refer to them, of the tooth. Let's go back there, and oops, not that one. Let's go to this one. Okay, and this is where it traced out on the CBCT. So this is that same little stick that you see in the two-dimensional, and you can see just how far up in there that goes. So this is all bone loss. Now, of course, you're not used to reading these sorts of things. What we should be seeing here, and we'll see later, is this is actually the sinus up in here. So this infection has eroded through all the bone, through all the bone that was around the tooth, through all the bone that was the bottom of the sinus, and this infection is going up into the sinus. We know that about half of chronic sinus problems are really tooth problems. They're not sinus problems at all. So by checking these things out and making sure your teeth are okay, you may avoid a little sinus surgery. Now, that's not to say that we're going to take care of your root canals and you'll never have sinus problems again. But obviously something like this is going to cause a problem in the sinus. So let's take a look at that also then. We'll look at some of the other portions of that CBCT x-ray. Here it is. This is again that three-dimensional view, so you can get the idea of how much bone has been eroded up in here. That little tracer there, that's part of the tracer. And then here it is now from the top view. So we're looking down on the sinus area, and we're seeing the roots of one tooth right here and one tooth right here. This is the tracer. Again, you're looking down on top of it. So what do? Well, we do the root canals. We do the root canals, recall, with the GentleWave process. check that out at GentleWaveTexas.com. That's GentleWave, TEXAS.com. And it'll talk to you more about the GentleWave process. This is what's making the difference. Obviously, I've been doing root canals for a long, long time. And we've been using this GentleWave process now for 5 years, and we're seeing phenomenal results with it. And this is one of those cases that is an absolutely phenomenal result by using the GentleWave. So recall now, we talked about how that root canals get reinfected. So this root canal that was originally done was redone. And again, GentleWave cleaning it out. And then the tooth in the back, also dead or necrotic, so a root canal was done on that one. You see a slight overextension of some of the filling material here, but that body gets along with that one fine in this particular case. So here we go. So this was after we did the redo of the root canals. Okay, now we move ahead. Let's go back and take a look at the picture. So we redid the root canals, and remember this big old nice little infection here that was going on. So come back in 3 weeks, and what do we see? Let's pin that on the board so you can compare them side by side. Look at that. All of that area of swelling, all gone. 3 weeks. And no antibiotics in this one. This was just strictly from cleaning it out, getting the GentleWave to clean the tooth to a whole new level of clean, and this sinus tract resolved. Phenomenal. And then there it is again, kind of looking at that same angle, so you can see how all this is resolved. Now, this was actually just taken recently, so as to see how things have progressed, and now this is maintaining itself. Let's take a look at what's happened with the bone, though. That's what's phenomenal. That's what's so cool. Let's get that out of the way. So recall we had this big old infection up here where it was tracing. Let's pin that on our board here. Let's go take a look at our root canals. And this is, that's the side view. There we go. This is the side view of the tooth. So this is the same view. Okay. So remember how we said no sinus, no bone, no floor. Now look at this. This is the floor of the sinus right in here. Right in there. And all this is all that bone that has grown back in that was gone. So now this is looking up and down through the tooth. So we've got the roof of the mouth over here. We've got your cheek out here. So we can see now how that all that bone has reestablished along the roof of the mouth. All that bone has reestablished along the cheek side. The bone is reestablished here. The floor of the sinus is back. Of course, our patient had reported that he was having sinus problems at the time, chronic sinus problems, mostly every year, ended up with a pretty nasty sinus infection. At this point, no sinus infections for the last 2 years now. So this is a 2-year follow-up on this particular case. Now, let's take a look too at the bone on the top. So that's what our bone looked like on top, looking down on the tooth, and recall all that bone was missing in there. So all that bone now has grown back in and has reestablished itself. So pretty phenomenal healing with this GentleWave process. We can see the tooth, the side view of the tooth was here, remember? Back in 2018. Today, let's take a look at the same CBCT. So again, you can see how this is not quite exactly the same angle as you can see. The roots look slightly different, but you get the idea how all this bone has grown back in, how the floor of this sinus has reestablished itself. So phenomenal healing results here, things that I just would not have seen doing conventional root canals. Not to say that conventional root canals can't do well for you, but this is the kind of healing that I'm seeing with the GentleWave process. Phenomenal stuff. So I appreciate your time. If you have any questions, please feel free to give us a call. You can check it out on our website at drmikeford.com. You can also give us a call at area code 254-554-3636. Thank you so much for your time.